Good afternoon, colleagues. Today I will be presenting the research I've compiled in my paper, Anxiety Control in Athletes. The purpose of my paper was to examine anxiety, determine the factors involved, and provide recommendations for athletes coping with anxiety. My thesis was that athletes experience anxiety, and there are several factors involved in this anxiety. My method was to conduct an extensive review of the current literature. My results indicated that there were 4 factors involved in athletic anxiety: environmental, psychological, emotional, and physical factors. Results also indicated that there were several agencies involved that provided education, support, and services for psychology professionals, exercise specialists, and athletes and their support staff. Also, that there were several recommendations available to help athletes cope with their anxiety. My conclusions were that anxiety is common. However, there are several resources to help athletes cope with this anxiety. The factors involved with anxiety included environmental, psychological, emotional, and physical factors. A study by Baker, Coate, and Hawes noted that one of the most important relationships in an athletic environment is that of the coach and athlete. Specifically, a 2000 study found that coaches who exhibited negative coaching behaviors resulted in having athletes that experienced the most anxiety. The behaviors of most consequence were using insulting or abusive language. This resulted in excessive anxiety, worry, and loss of concentration in athletes. A 2011 study by Esfandiari found that negative press by the media and fans was also greatly associated with increasing anxiety levels. Athletes often feared losing their reputations or disappointing fans, which increased their anxiety. The same research by Esfandiari found that the transition from different sporting arenas, specifically that of high school to collegiate level and collegiate to the professional ranks, resulted in increased anxiety. Along with a new role change, new coaches, coaching styles, staff, teammates, and the physical environment were also noted to increase anxiety. The psychological factor regarding an athlete's ability to practice self-control over their responses of outside stimuli. A 2012 research study by Englert and Bertrams found that coaching behavior and pressure by teammates or peers was a significant source of anxiety. Similarly, the fear of failure was also noted to produce more anxiety. The fear of injury or re-injury was noted in a 2011 study by Esfandiari. Further, a 2015 study by Kay, Frith, and Voslo suggested a lack of clear and concise goal setting increased athletic anxiety. Competing priorities for attention, such as academics, family, and social life, also increased anxiety in athletes, according to work by Englert and Bertrams. The specific emotion of worry has been studied extensively by sports psychologists, as this emotion has been found to be heavily associated with anxiety. Research by Kay et al. Found that parental over-involvement in sport was associated with increased worry in child athletes. Specifically, goal-oriented parents produced more worry in their children than parents who were mastery-oriented. Research by Baker et al. Noted that athletes who lacked a strong rapport with coaches, staff, and teammates also experienced more worry. And a 2005 case study by Davis and Simi found that previous traumatic experiences on the athletic field also increased the likelihood that an athlete would experience worry. Several physical factors have also been found to affect anxiety in athletes. Research by Kay et al. Noted that young child athletes were more influenced by goal-oriented parents and thus were more likely to experience anxiety. Similarly, work by Esfandiari suggested that student athletes experienced increasing levels of anxiety as academic and athletic pressures mounted. Race was also found to play a role in anxiety levels. A 2009 study by Anchel, Sotoros, and Jubenville found that African Americans were more psychologically invested in sport. However, Caucasian athletes experienced higher intensity of anxiety and higher levels of anxiety than their African American counterparts. The authors were not sure why these results occurred, but recommend that more research is needed in the field regarding race and anxiety in athletes. Work by both Anchel et al. And Esfandiari found differences in anxiety between male and female athletes. Specifically, females were found to experience more anxiety overall and were more likely to be intimidated by their coaches than male athletes. However, females were more likely to seek out social support than males when dealing with their anxiety. In a 2011 study, Esfandiari found that 24% of injured athletes experienced increased worry, anxiety, and depression, and this was strongest in the first 4 to 8 weeks post-injury. Further, a 2011 study by Podlog found that injured athletes feared re-injury, inability to perform at the same level, appearing unfit, and suffered a loss of athletic identity. And these all contributed to increasing anxiety levels. An interesting finding was that athletes who experienced the most fear about re-injury were more likely to suffer re-injury in returning to play. Similarly, those that were more worried about performing at subpar levels continued to perform at subpar levels once they returned to the playing field. 3 specific agencies were noted, each offering different opportunities in education, services, and research. The American Board of Sports Psychology offers education and credentials to doctoral level psychologists, and entry-level psychologists are offered training and other resources to help them gain the credentials necessary to become a sports psychologist. There were also certificate programs available for exercise specialists. The International Society of Sports Psychology is an organization dedicated to scholarly research in the field. Newsletters and journals are printed and circulated, and the society upholds to the strongest moral ethics regarding research. The Association for Applied Sports Psychology provides training, lectures, and workshops for exercise specialists. These include coaches, youth sport leaders, athletic trainers, and corporate fitness leaders, as well as other fitness specialists. The specific concepts of anxiety management, focus, goal setting, self-talk, and team building exercises are addressed through these programs. 5 specific recommendations to help athletes cope with anxiety were also found in the research. These included self-talk, self-control, imagery, improved relationships with coaches, and workshops. Self-talk includes internal dialogue, and it can be either positive or negative in nature. A 10-week self-talk intervention on 41 male swimmers resulted in an improved performance over a control group that did not participate in the self-talk intervention. Similarly, a 2007 study by Hamilton, Scott, and McDougall found that positive self-talk aided in endurance performance in athletes. Davis and Simey suggested that increasing self-control improves focus and decreases anxiety in athletes. In a case study with a collegiate baseball player, the researchers had the baseball player partake in a series of controlled breathing exercises, focus exercises, and vision tracking tests. After the intervention period, the subject's performance on the playing field improved dramatically, with a higher batting average and improved strikeout ratio. A 2011 study by Musavi utilized mental imagery with tennis players. The research found that players who utilized mental imagery techniques were less anxious and experienced improved performance versus the control group who did not partake in the mental imagery intervention. Further, Musavi and Davis and Simi noted that benefits were more pronounced when mental imagery was incorporated with other techniques. These included self-talk and goal setting specifically. Improved coach-athlete relationships has found to greatly reduce anxiety levels. Research by Baker et al. Found improved coach relationships significantly reduced anxiety levels among youth baseball players and wrestlers. Negative rapport was also strongly associated with increased anxiety levels. And further, research by Esfandiari and Podlog suggests improved social support by coaches help injured athletes hasten recovery and maintain their athletic identity. Research involving mental skills training camps and workshops found that overall anxiety was reduced and performance improved. In a study involving 42 track athletes, half attended a workshop intervention, the others were told to relax by either reading a book, watching TV, or going shopping. After the 10-day intervention, athletes in the workshop exhibited more optimism about their abilities and reduced anxiety about their performance. Similarly, in a 2012 study by Vidikar, athletes struggling with pre-competition anxiety partook in a 12-week workshop intervention, which incorporated numerous mental skills. After the intervention, the athletes experienced significantly reduced pre-competition anxiety. In conclusion, this research focused on athletic anxiety. It also noted that there are several factors involved that affect anxiety in athletes. 3 specific agencies were also discovered and explained, and recommendations that help athletes cope with anxiety were also examined. Thank you for your time, and I'm glad I had the chance to talk to you today.